are just about 2 weeks from the end of the Medicare annual enrollment period. The deadline is December 7th. There's a lot of free, legitimate help with choosing a plan, but our next guest says scammers are also in the mix, hoping to snag your personal and financial information. Joining us to help you spot and avoid these scams is Justin White, CEO of Senior Health Services. But first, let's address the safe help they can give you for free. That's the new word. It's free, right?
My new favorite word, free, yes.
All right. Realizing somewhere along the way that when seniors retire and have a limited income, a health crisis could literally wipe out their retirement. Mm-hmm. So Medicare came in as a safety net.
That's a great way to describe that. So yes, exactly. I mean, way back in the day, there wasn't this structure, this subsidized structure for seniors. And so back in the 60s and before, they were just kind of on their own. So Medicare came along. One of the results of that was to protect them and make sure that they did not get wiped out later on. They had something there that would help them with their health concerns going on into retirement.
With that said, it's a government program, so there's lots of moving parts. It can be complicated. You all want to make sure that people are not alone. So Senior Health Services, you're an independent brokerage, over 300 agents, and your goal is to help clients with Medicare. Again, free service. The biggest mistake many seniors might make is to just let it auto enroll or do nothing.
Absolutely. They will. And I've got perfect examples of that all the time. People come in. I had a lady that I helped this week that had been in a plan for 11 years and was wondering how come it was just not appropriate for her. The plan was fine, but it was no longer appropriate for her.
Things change.
Yeah, and so just making a few little changes, I may be jumping the gun a little bit, but just making a couple of little tweaks, it wasn't even that much. Yeah. She's going to save somewhere in the neighborhood of maybe $7,000 per year.
That is crazy. Yeah, yeah. She had some affordability issues, and she said she couldn't afford the plan anymore. You're like, okay, let's dig in there and make it more appropriate for you. All right. Another client you had was paying over $3,000 per year for medication. Y'all got that dropped to less than $600.
Yes, exactly. Now, one of the good things about the Inflation Reduction Act is they did come in. Now, the funding changed, causing some issues, but there's some people that are on really expensive medicines. It may very well help them. Yeah. And so just making sure we know where the help is, we can shift somebody from one place into another, and just by virtue of that law and the things that came about, it lowers their cost a lot.
Yeah, and you bring up that law. Those things are also things that change, which is why people need to pay attention.
Exactly.
All right, yet another woman, she was in med supplements, and so she was paying over $300 per month, and you got that adjusted to $135.
That's exactly right. And it's not, I'd like to say and come on here and say, oh my gosh, I'm a genius. Yeah. But it's not. It's a matter of that she was just simply in a plan that was more inflationary than some of the other ones. And she was still able to qualify to move from one to another, and that's all we did. And again, it's the knowledge of knowing what's out there, and that's what's great about being a brokerage is we shop all of them and know what the options are.
Yeah, there was a news story that just came out the other day about how many billions of dollars we lose every year because people are scamming in the Medicare space. And so and a lot of times seniors have a tendency to be a little bit more trusting, or they know it's the enrollment period, so when someone picks up the phone and calls and starts talking to them, they're like, oh good, I was thinking about getting some help. So what are some of the things that are like, well, they're told to renew their plan each year?
Oh my gosh, that's the number. We have people that will come in and say, okay, I'm scared I'm going to lose my plan. I've got to renew. What do I need to do to re-up? Yeah. And that is a scam. That is shady. What they're trying to do is get people to call so they can move them to something else. If you're in a plan and it's not being canceled and you like it and you want to stay, you do nothing and let it roll over into the new year. Yeah. Right? If your plan is being terminated or it was degraded because of the cuts that happened recently, you're not going to renew that thing. You're going to go shopping and get something else that's better. So this stuff about needing to renew or re-up, they're just trying to get you to call the number.
Yeah. And then of course when they call you, you didn't seek them. They call you and they're like, okay, we need your social security number, we need your Medicare number, we need sensitive information, your bank routing number, all that type of stuff.
That's a great point. That's scam number 2 that I want to talk about. So the first one is, oh my gosh, you have to renew. The second thing is when you get these folks that are cold calling. Another example, I had a client last week called and said she actually got a phone call from somebody that claimed to be from Medicare. And she goes, they said they wanted to verify that she had received her plastic Medicare card. I was like, oh my gosh. I said, those are not plastic. She goes, I know, it's paper. Yeah. Exactly. So I said, that was a scam. I said, did you give them the number? And she said, yes. I said, okay. I said, look, not ideal, but you probably just enrolled in something.
Yeah.
So do not give your Medicare number to a cold caller. If you don't know who they are and they just call you out of the blue and they ask you to verify something or whatever,
assume it's a scam.
Do not do that.
Yeah.
Because you're going to enroll in something inadvertently if you do.
Yeah. So what people should do is do the plan review. You may think you're okay in something, but you all can look at it as we just proved and reduce cost, or
Absolutely.
introduce something like if you're on a new medication or you have a new health issue, that you can make sure that they're covered with that and they can see the doctors that they need to do.
Exactly.
So, yeah.
Right.
Don't try to figure it out by yourself when you have experts who will do it for free. To get the free, yeah, 2 syllables. To get the free help with finding a Medicare plan that works for you, visit seniorhealthservices.com. That's seniorhealthservices.com, or give them a call at 281-894-7540. Again, that number is 281-894-7540. We'll be right back.